think my child is having trouble with reading. And I have the one and the only Dr. Palmer. She's a pediatrician and she is the founder of Pure Joy. I'm going to let you introduce yourself, Doc, but thank you so much for coming on here. I know it's early. I appreciate you coming here. So thank you for being here. How are you?
Hi, good morning. Thanks for having me, Dr. Tolu. It's really a pleasure to be here to talk to you and your audience about children and early literacy. As you mentioned, I am a pediatrician, a general pediatrician, which is so fun because it means I get to see everything. We get to talk about everything. I think a lot of times people think, oh, well, we just see our general pediatrician for vaccines and well-child visits, but we talk about scholastic development, growth, nutrition, all of the above. And yes, I just opened my new practice in Portland, Oregon, Pure Joy Pediatrics. And so far it's proving to be absolutely that. It is pure joy to go in the office and see patients every day. So thanks for having me this morning.
Oh, my pleasure. And I love the name Pure Joy. Like, it sounds so much like you. So this is good. So I like that
Yes.
your practice is reminiscent of you. So this
it really is. Yeah.
Mhm.
It's wonderful.
Now I was going to ask you though, why do you do what you do? A story would be helpful. Like, why did you go into peds?
Oh gosh, I don't think there was another specialty for me. I think I briefly considered med peds because I actually think that working with patients who are octogenarians, it's very similar to working with younger patients. But I think at the heart of it, when I was little, my mom was a gardener and I loved watching things grow. I just assumed that most pediatricians must be gardeners at heart because we love watching things grow. And there is nothing, I think, more beautiful than seeing a baby hours old and then watching that baby grow up to be a toddler and then off into, into school. Some of my patients are getting ready to graduate from high school.
Wow.
I love that. I love having seen where they came from and to see where they're going. And just to be a part of that and to witness that transformation, I think is one of the reasons why I really love pediatrics. I was thinking about this last night. I suppose there are other specialties where you get to watch this and have this continuity of care, but pediatrics really, I think, holds it all. We really get to see this amazing growth and development and accompany parents all along the way and reassure them. Sometimes we're jumping because we're worried about our patients, but it's a beautiful process to be a part of.
I agree. And, it was unique with peds. It's a big morph from baby to adult. Like it's a big, as opposed to, you're seeing an adult steadily as they age, but you see that moth to butterfly, like, whoa.
Yeah. And I think it's more than just watching, that metamorphosis of the patient. It's watching the parents as they grow and evolve as parents as well. And I just find this fascinating. I will tell parents, so this is your little baby human who currently is a newborn. And then later on we talk about, I'm like, do you remember what he was like as a newborn? Same human, but developmentally very different. And now your skill set as a parent has to grow too, even though this is the same child you gave birth to. Yes. Now he's 2. Now we're getting to other issues. And the skill set you had when he was a newborn now has to change and adapt to kind of catch up to where your child is developmentally. Because they grow and they develop, and we're kind of back here. And they're like over here. We're like, what? You can eat with a spoon? You're drinking out of a straw? Like now you're walking? And we're still kind of stuck to, where they were when they were younger infants or newborns. And so parents have to transform too. It's fun.
The kids grow and the parents grow. I love it. I love
it.
I love it. I love it. Now, for those who are watching live, #live. Those who are watching replay, #replay. All right. So next question. We're talking reading, Doc. What's the big deal? What's the importance of reading?
It's one of the ways that we expose children to different ideas. It depends on, what age group you're talking about. So I guess I would just kind of back up and say that it's never too early to start reading to your child. What you would read to them or the books that you would introduce to them really kind of varies depending on the age of the child. So for instance, I would recommend using high contrast books with really young infants. Turns out the visual cortex and the visual pathways take up a big part of our brain. And so just stimulating a baby's vision by having high contrast books, those black and white books that maybe have everyday objects in them, not only, stimulates them visually, but it stimulates their brain to grow. And it provides a medium where you're showing a young infant, you're kind of developing a routine with them, right? But you're showing a young infant that books are entertaining. They're a source of interest. And that, I believe, develops like early literacy skills. And then later on, when your infant is old enough to grab the book, like a 4 to 6 month old, they might be more interested in colorful pictures with everyday objects in them. I kind of say it doesn't matter how your child is enjoying a book, it still introduces that concept of early literacy. So whether your 4 to 6 month old is grabbing it and putting it in their mouth and teething on it, and you're trying to page through the pages to show them what's interesting, like that early exposure, it's in there. It's like in their old memory banks, and they know this book is entertaining because I'm eating it. And then later on, when they're able to interact with the book more and put their fingers through the holes, there's those touch and feel books, whatever kind of book it is that engages your child, even that early on, is worth investing time and sitting with your child to look at that book. And then as they get older, becomes maybe part of the bedtime routine or an afternoon, like nap time routine, where you're reading to your child. What you want is for children to feel like books are engaging. And so depending on where they are in that continuum of childhood, it's a source of learning vocabulary and introducing new concepts. It's a source of entertainment. And as we get older, books are a source of knowledge, right? So if you think about it, almost any subject in school that you introduce to a grade schooler, they got to read to learn about whatever that subject is, whether it's social studies or math or, English literature. The crux of it all is you have to know how to read to get to that information.
And I'm glad we're having this conversation because it's important to prioritize it. Even if the baby's not talking back to you, you don't feel like there's any feedback. It's important for brain development. And studies have actually shown that even as early as talking to the baby in the womb actually helps with brain development. So this is key. Now I have someone who's listening who's like, oh, well, doc, what if a device, a smart device? Can I just do that? What would you say to that?
Well, I mean, I don't think that that's like an exact substitute, but it's certainly a good supplement. So like, let's say you're busy making dinner and your toddler's sitting there with like, a whole group of books, and you put, a book on CD, or, it's an older school age child, and maybe they are having trouble reading. Actually listening to an audiobook while they're looking at the book visually is not a bad idea, but it is not a replacement for having your child sitting next to you or on your lap and actually engaging. Because part of it is, yes, it's the book itself, but secondly, it's the activity of sitting with your parent who's engaged reading with you that makes a huge difference in terms of like a child's interest in reading development. And I think at the crux of it is like, well, how do you raise a reader, right? How do you encourage children to want to read? I think probably part of my interest in this comes from the fact that I was an early reader. My son is not an early reader, but we did that early literacy stuff that I was talking about, like having those black and white books and sitting with him on my lap and letting him grab the book and eat it. And then, the bath time books and, books with a lot of visual contrast in them, all to kind of engage him to understand the concept that books are entertaining. And now as he's older, to me, it doesn't actually really matter what he's reading as long as he's reading. So we're into graphic novels, we're into National Geographic, for kids and things like that. As long as we're understanding that what I am reading, I am learning from, I'm engaged, it really doesn't matter what they're reading. I mean, obviously, as long as it's age appropriate. And he's almost 11 and we're still reading bedtime books. Last night we read about like Hawaiian legends. So, and then before that we were reading Little House on the Prairie. And so it's actually, I think your role as a parent who is encouraging reading kind of changes over time depending on the age of your child. But I think they always love being read to. So, yeah.
I agree. Even at older ages. So as long as they let me read to them, I'll let them read. And so the encouragement here is to create options and avenues for your children to read. But we'll delve more about that in further questions. Yes. So how do I know when my child is to start reading? That's a parent asking, like, when are they supposed to start? And how do we figure that out?
Right. Well,
Yeah.
COVID kind of made that an even more interesting question. What we found that it was really hard for, so typically children start to read around kindergarten, but it can be anywhere from kindergarten first and second. An elementary school teacher will tell you all children are reading by age 3, by third grade, not by age 3, by third grade. And depending on how much difficulty a child has with reading for different reasons, it could take up to the third grade to really like figure out how to read fluidly. I think that as a parent, you want to kind of watch and see if your child is showing signs of early literacy. What does that look like? You've been reading to them ever since like early infancy, and all of a sudden they're like, oh, letter M, letter O, like you're driving along and they're picking out letters, right? Those are signs of early literacy. They are recognizing letters. They may even make the sounds to the letters. I definitely encourage, like, if there's a favorite book for a child, one of the reasons why they like it so much, it might be the cadence of the language in the book. It might be the pictures, but children have kind of a memory for music. And if you are reading a book over and over again, it's almost like you're singing a song over and over again, and they start to pick out the words. So, I have patients who will stand there and they will tell their parents what's in the book. And these are like young children, like 2 years old or even younger. I think part of it is because there's some letter recognition, but there's also picture recognition, and they start to memorize the books. Even though they're not quote unquote reading, they act like they're reading, or they'll sit there and have the book upside down. Mm-hmm. So those are all signs of early literacy. And then picking out those letters, recognizing them, and then starting to just make sounds. I remember learning to read by memorizing a Dr. Seuss book. Like, I had it memorized and then I was able to read it. But that may not always be the case for some children. I will usually encourage parents to listen, to what the teachers have to say, like the kindergarten teachers and the first grade teachers, because they're teaching a big class of kids, and they can kind of pick out the children that may be struggling a little bit more and identify them to be able to give them more support. A lot of times when kids don't like reading and they're in kindergarten or first grade, they'll shy away from tasks that are difficult. And so this is really where, like, being a parent who's engaged with reading makes a huge difference. You can do things like read the same book over and over again, or have your child read the same book over and over again so that they build their reading confidence. Don't select different books. I would almost say, like, the topic of the book doesn't matter. It's just the fact that they're picking it up, they're interested, and maybe they feel more comfortable reading the same book over and over again because it helps. They're more fluid with it, right? You just want to build their reading confidence. And then another really fun thing that you can do with a child that's struggling with reading is you can read one line and then they can read the other line. Or you could read and just show them, like, some of those key sight words like the, and have them, like, I would read to my son and then I would stop and he would pick out the word, and he would read the one word, like the sight word. So reading in tandem like that can be really helpful with children who are struggling to read. But yeah, anywhere between kindergarten and first grade is when you see children kind of emerging as first readers, but you can see it younger, like 4 and 5.
Mm-hmm. Mm-hmm. All right. So we're encouraged. Keep reading. Now, and I want to ask this question this way: when should a parent bring up the concern? Because I had discussion with parents where they're seeing a pediatrician, and I'm like, did you talk to your kid's doctor about your concerns about his ability to read or not read? And they're like, well, they didn't say anything, and so I didn't. So what is a typical visit with you, like, Dr. Kirin, in assessing, let's say, an infant? Like, how can a doctor help with identifying some of these things or these issues before it becomes a big deal?
Well, I think the first thing is encouraging reading altogether, because if you're not testing it out with reading with your child and engaged with them and sort of seeing their level of interest, you're not going to know. Right. And I have had patients before where parents, I would say, like, maybe even like 18 to 24 months, you can start to see, like, the lack of exposure to books can affect a child's ability to gain vocabulary. And this is kind of goes back to what we were talking about before, like, why read? because you're exposing your child to new concepts and new vocabulary that they'll not come across. So for instance, like, how do I know what a tractor is? Like, how do I know what the word tractor looks like? Because I have a book about a tractor, not because I live on a farm, right?
Right.
You're introducing them to concepts and vocabulary that might not be in their normal everyday usage, right? And so children between 18 and 24 months, many times, and especially through the COVID pandemic, where we've really kind of discouraged social interactions, which is where they pick up language and also they're being socialized. Some children who have come through the pandemic really have this paucity of vocabulary because they haven't been with other kids. And so one way to kind of help encourage that is by reading to them. Now, what I'll tell parents in that age group between 18 and 24 months is, if your child, because I actually had this conversation this week, if you're worried about your child's vocabulary and lack of like expressive language, we tend to, and I find myself, even as a pediatrician, and I know this, we ask our children questions when we show them a book. And when you're trying to teach somebody language, you need to be telling them what the words are. And so as you page through a book, like, children will have a favorite page because maybe there's items on it that they are familiar with, but they don't know the names of. So maybe they'll have you stop at the page with all the fruit and the vegetables on it. And instead of saying, what is this? What is this? Which is a really fun game when you know what the word is, you say, this is an orange, right? I used to do like these, I would call them multi-dimensional like sessions with my son, and I would take out fruit and vegetables and the book so that we could kind of relate that the physical object of the orange is the picture in the book, and this is an orange, right? Or he really liked animals, and we would go to the zoo and I'd have a picture book with the animals in it. And we take the little physical, like, he had like little plastic animals, and we take those with us to the zoo. And, you know, he'd be holding the tiger, and we'd be looking at the tiger, and be looking at the tiger in the book. And so that's a really nice way to introduce the concept of like, what you're seeing in a book is really transferable to the real world. And so I would encourage parents, like, especially if you're worried about your child's expressive language, like they're not talking, rather than ask questions, tell them what it is, right? And use a lot of language, like repetitive language. And they'll ask you to do it because they're interested in this one page. You just go over the page of like, here's the shoes, here's the boots, and you may be bored, but they are learning language because you're showing it to them in a book.
That is key. And you're going to sound like a broken record, because I remember this phase with my kids growing up. Like, we had letters and we had an A day. So A, and everything A, we would say, and when guests would come over, they'd be like, okay, y'all.
That's awesome.
Like,
I love it.
So we kept A. So today's a B day. Oh, but what is B? So we sounded, at first I was like, what are we doing? Are we making sense? But we see the results now. So please be encouraged. Keep over and over again. They don't mind. Trust me. They don't mind.
They don't. No, because they actually feel encouraged. They feel confident about their abilities because you're doing it over and over again, right?
Yeah. Yeah. Now, someone is watching and they're like, oh my gosh, between everything I have to do, getting the food ready, getting them ready for daycare, and sleepless nights with, they had a cold and a cough. Where is the time to do this? What are tips, Doc? What would you say are tips?
Well, I would say having your books prominent. Children will tell you when they want to be read to. Like, if you don't have to do it every day, but like if there is kind of a routine to reading, maybe just a couple days a week, if you have like a bookshelf that's kind of low, and you can put your child's books there, and they're prominently in your family room. I mean, I still have the bookshelf that I got for my son when he was a baby. It looks like one of these like library bookshelves where like it's actually like the front of the book is displayed versus the spine of the book. Right? Like, if you go to a children's library, even like a children's bookstore, that's how they're displaying the books, because that's what's going to grab your attention, is the picture on the book. So having them out as if they were playthings. And I mean, even a toddler, like a 12-month-old can go and grab their favorite book. Even a 6-month-old will grab at their favorite book. So if you have it just there, kind of like a toy, something entertaining, they'll tell you when they're ready to read, or they'll try to read themselves. And then you're like, oh, let me take a minute and let me read to you. There's other things that you can do in your life. Like, I'm the queen of make ahead. Like, I do casseroles, I do whatever, so that it kind of frees me up. We eat a lot of leftovers. It frees me up to not make dinner every night. And that way we have more time. These days we're like playing checkers, and we're also reading. So it gives me more family time. So you can kind of make little tweaks in your schedule that maybe open you up. Now, if your children are sick, they're not probably going to eat like they normally do anyway. And yeah, you're going to have to tend to them if they have like a runny nose or a cough like that, or, you know, like they might want to be consoled, and you can sit there and, you know, ask them if they want to read their favorite book, because you're up anyway with them.
That is key. That is key. Give them options. Don't care too much about having a perfectly clean house.
Oh,
let
no.
Let the books hang out. I even have them in my bathroom, in their bathroom. I have for them to grab.
That's awesome. Yeah, we used to have them in the office all the time, and then when COVID hit, we picked them up because they were, you know, they could transfer germs and things like that. I would love to see the books come back, but it's hard to wipe them down and have them last. So, yeah.
All right. So, one more question: How can a parent empower? Let's say you have a child who's in daycare most of the time, and then like, you know, I would like to see if people that my kids are around can encourage them in their reading habits too. What tips would you give to the parent who's listening and curious to know if this is possible?
Well, I think I probably already make the assumption that a lot of daycares have books available, and adults that take care of children know that children typically love to be read to. Like, who doesn't like being read to? I mean, I think even like a grown up, like if somebody's reading, you know, you kind of stop. You're like, oh, they're reading the Grinch, you know, the Grinch Who Stole Christmas, or what have you. And a lot of daycares and childcare centers will, and this might actually be a question that you're going to ask when you're interviewing a daycare. And, you know, I get it. Like these days, I think finding quality childcare is a little tougher. I don't know about Texas, but I know this is the case in Oregon. And like some of us are just happy that like there's availability and that we got in off the wait list, let alone like the finer nuances, which is like they actually are reading to my child. But most, you know, high quality childcare centers will have like a circle time where the teacher might be reading or something like that. You could even just send the books in the diaper bag.
Yep.
And just, I mean, like everything that goes to daycare has to be labeled. So, you know, definitely label it. And then, you know, you might suffer some losses, like they might not come back or they might get torn up. But I think just having your child's favorite book available so that they can actually reach for it, like when, you know, the attendant opens up the diaper bag, might help encourage that. Because your child's going to see it and say, oh, there's my favorite, like, you know, pigeon, you know, don't let the pigeon drive the school bus book. And I want to, you know, I don't want to read that, or I want to chew on it or something. And so I think that's one way to encourage it. And then again, like if you have childcare in home, you can send it with your diaper bag, or if that person's in your home, again, like having those books prominent will allow your child to kind of cue that they want to read. They'll go grab books. Like children, like toddlers will go grab their favorite book and they'll grab their parent's hand and they will join the two and say, this is what I want, even though they can't like actually say all of that. So having them prominent, having books all over the place. I think, you know, I end up giving away a lot of books because we just
you know, and other things you could also donate books, old books to the daycare as well. You know, libraries and giving them out at discounted prices. So you could do that too to encourage. Hint, like here you go, more books.
Well, and not to put more pressure on parents. And I think we're all just kind of used to reading on screens a lot, but try to have physical books in your hands so that your children can see that you are reading. If they see you on a screen, and I get it. I mean, I'm guilty of it too. There's just, you know, that little handheld computer is so powerful. We can get to so much more information. But if your children see you reading, that's probably the biggest teacher for them, that reading is something that we do in this household. And that really speaks very powerfully to encourage them to become readers themselves.
Yep. We teach them more by what we do than what we say.
Oh, all the time. Well, they learn from what we say too. They pick up on the stuff we don't want them to pick up.
Oh man, this has been so informative. I'm so happy for those who are watching live and for those who are watching this in replay. But Doc, I have people who are watching, some maybe from Oregon, who are like, "Where's this Doc? I want to connect with her, or I want to have her come speak at a platform where I'm talking about empowering parents." Doc, where can people find you?
Oh gosh, thanks for asking. Well, I have a physical space. I'm usually in my office Monday through Friday. We're in the Tigard area, Portland, Oregon, but you can find us on our website. It's got our address and phone number on it. It's www.purejoypediatrics.com. It's a really fun website to look at, and you'll see my face
Yeah.
on the landing page. And then I say I live on Instagram. If you just look for Kirin Palmer Kirin Palmer MD, all one word, lowercase, you'll find me there. And then on Facebook, Kirin Palmer MD. But I like to spend a lot of time on Instagram. I find it a lot of fun and easy to manage. And, the direct messages come in pretty easily too. So yeah, that's how you can find me.
I like watching you on Instagram, by the way. And so it's fun watching you. I love your videos. So you guys follow her. She's awesome. She's awesome.
Yeah. I had so much fun. I put all sorts of stuff on there. I read a bunch of Christmas books to my patients.
I love that. That was fun. That was what gave me the idea of this. I have to tell you, that was good.
I wanted to read my favorite books and share them. So it's a medium that allows for that I maybe can't do in the office. And also too, in the office, we're usually wearing a mask. And so it's kind of a fun way for my patients to see me without a mask. So
I concur. And at the end of this live, we'll have that information posted so that people can connect with you directly. But thank you so much for coming. This was fun.
Oh, it really was fun. I enjoyed it.
Oh, my pleasure. My pleasure. All right. Thank you all for watching. Please share. Remember, caring is sharing. And if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician in the Mansfield area who will empower you and your kids to live long and well, I am she. Have a good one, Dr. Palmer.
Yes, you are.
You're posted awesome. It up already. So we posted where to find Dr. Palmer so people know how to connect with you. This is
awesome.
Good.
Thank you so much.
Bye.